Om Swastiastu. Hello everyone. So today in this opportunity, we from SGD B4 we present our student project entitled Nutritional Advice for Diabetes During Vacation. So let me introduce myself. My name is Erick Gonata with 3-digit of my student ID is 096. Talking about patient with diabetes, uh, that managing diabetes is a lifelong endeavor, and diabetics face a unique challenge of maintaining optimal glycemic control while on vacation because vacation changed our usual habits, and vacation uh, can give us unfamiliar eating environment and increase the temptation to eat less healthy food. Therefore, it is very important for people with diabetes to have access to good nutritional advice that allows them to make informed choices and stay healthy while enjoying their vacation. The importance of diet in diabetes management cannot be overemphasized. A balanced diet and appropriate medication and lifestyle choices plays a central role in maintaining stable blood sugar level and preventing complication. And then for people with diabetes, it's important to understand the impact of vacation-related factors such as changing eating habits, unfamiliar diseases, and increased physical activity. Um, they need to understand these factors in order to keep their condition under control. Therefore, with proper nutrition advice, individuals can overcome these challenges and make choices that meet their nutritional needs and health goals. So in the student project, we got seven problem formulations, which are the first one, what is diabetes? The second one, how is the epidemiology of diabetes? The third one, what are the types of diabetes and how is the etiology of each types? The next one, what is nutritional advice and why is it important for diabetic patient? The next one, what are the threats of going on to vacation for diabetic patient? And then we got what are the nutritional advices for diabetic patient during vacation? And last one is what are the factors and threats of non-adherence towards nutritional advice for diabetic patient during vacation? So for the next part of the student project will be presented by my colleague. Thank you.
Good morning, my name is Chris Edgar and my last digit of student number is 045. Next, I will explain the definition and epidemiology of diabetes. Diabetes mellitus is one of the most common chronic diseases in the world, occur when insulin production in the pancreas is insufficient or when insulin cannot be used effectively by the body. According to the Bali Provincial Health Office, diabetes cases in Bali province rank second in top 10 advanced outpatient diseases with a prevalence of 1.7%, so that a total of 67,172 people suffer from diabetes mellitus in Bali.
Okay, thank you for the time. My name is Nyoman Gede Satria with the last 3 digits of NIM number 011. I'm going to explain about the types of diabetes. Next slide, please. According to ADA or American Diabetes Associations, diabetes was divided into four big groups, such as type 1, type 2, GDM, and other specific types of diabetes. The first one is type 1 diabetes. Type 1 diabetes can be divided into immune mediated diabetes and idiopathic type 1 diabetes. Immune mediated diabetes is happen because of destructions of the pancreatic beta cells caused by autoimmune reactions, and most cases are found in children and adolescents. On the other hand, type 1 diabetes that have known etiologies, there is no indications of autoimmune reactions, and only small amount of cases called as idiopathic type 1 diabetes. The second one is type 2 diabetes. Type 2 diabetes is the most common type of diabetes. This type of diabetes could be in the form of relative insulin deficiency and peripheral insulin resistance. The cause of type 2 diabetes are various, and it's called as egregious 11. So the next one is GDM. GDM or gestational diabetes mellitus is a diabetes that was not diagnosed before the pregnancy but appear in the second or third trimester of pregnancy. GDM is caused due to beta cells impairment and tissue insulin resistance. The last one is specific types of diabetes. So the specific types of diabetes are types of diabetes that are caused by specific cause. For examples, monogenic diabetes syndromes or genetic defects, and then disease of the exocrine pancreas, endocrinopathies, infections, and drug or substance-induced diabetes. I think that's all from me. Next will be continued by my colleague. Thank you.
Hello, let me introduce myself. My name is Calista Amore Manurung with the last digit number 208. Now I will explain about the etiology of diabetes. Okay, first, type 1 diabetes, formerly known as insulin-dependent diabetes or juvenile diabetes, is an autoimmune disease in which the immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. The next is type 2 diabetes, or formerly known as non-insulin dependent diabetes or maturity onset diabetes, is the most common form of diabetes and accounts for the majority of cases. It is characterized by insulin resistance, in which the body's cells become less responsive to the effects of insulin, and the pancreas gradually loses its ability to produce enough insulin. And the last one is gestational diabetes. It occurs during pregnancy and is characterized by hyperglycemia that present during pregnancy or it's first recognized during pregnancy. Hormonal changes during pregnancy can cause insulin resistance. The exact cause is not fully understood, but hormonal genetics factor may play a role. That's all for me. The next part will be explained by my colleague. Thank you.
My name is Sutedia with the last three-digit name 080. I'm going to explain about medical therapy for diabetes. There are various options for the pharmacological therapy of diabetes, which include insulin therapy and non-insulin drugs. But before traveling, it is essential to ask a healthcare provider to prescribe sufficient amount of insulin and oral therapy and the appropriate regimen. The equipment needed for insulin administration should also be prepared prior to the travel. First up, insulin therapy. There are three major kinds of insulin, which is the first one, rapid acting or prandial, which works to prevent spikes in glucose levels after a meal by increasing the glucose uptake in muscles and fat, and then intermediate acting, and then long acting or basal insulin, which acts to regulate hepatic glucose production. And then there's non-insulin therapy, which includes metformin, which works by insulin sensitizer and reduce hepatic glucose production, and then sulfonylurea, which induces insulin secretion, thiazolidinediones, which is also an insulin sensitizer, same as metformin, and then SGL2 inhibitors, which reduces glucose reabsorption in the proximal and a little in the distal renal tubule, and then DPP4 inhibitors, which increases insulin secretion, inhibit the glucagon secretion, and lastly, GLP-1 receptor agonists stimulate insulin release. The important changes during travel that should be noted is that storage first. It should be stored in a bag to avoid the insulin in too high or too low temperatures, therefore making it less effective. And then the timing. If you're traveling in different time zones, it is important to know that traveling west means a longer period, so a higher dose may be needed, and the same works if you're traveling east. The next part will be explained by my colleague. Thank you.
So hi everyone, my name is Khadra and Kamila with the last digit number 009. I would like to explain about the nutritional therapy for diabetes. Nutrition therapy is one of the 4 pillars of diabetes management. The composition of several foods that are recommended is a balance between macronutrients and micronutrients and the external factors. The measurement for some of them are, the first one is carbohydrates. No fixed amount of carbohydrates intake should be consumed by people with diabetes. However, patients over the age of 19 are recommended to consume with a measurement of 130 grams per day according to the brain's need for glucose. And for the fat, the recommended intake is around 20 to 25% of calorie needs and is not allowed to exceed 30% of total energy intake. And for the proteins, the recommended protein intake for diabetes patient with kidney disease is around 1.8 to 1 gram per kilogram body weight, while not less than 1 gram per kilogram for patients without kidney disease. And for the sodium intake of less than 2,300 milligram per day is recommended for people with diabetes. However, Patients with hypertension require individual measurements of sodium levels. And the last is for the fiber. The recommended amount of fiber consumption is around 20 to 35 grams per day. That's all from me, and the next will be explained by my colleague. Thank you.
Good morning, my name is Satria Putra. My last student number is 050. Today I will tell you about the definition of nutritional advice. So, nutritional advice are a guidance and recommendation given by the professionals to promote the optimal nutrition intake, prevent or manage chronic disease, enhance energy level, support immune system function, and to improve overall quality of life. That's all from me. Next.
Hello everyone, let me introduce myself first. My name is Veronika with my third last digit of my student number 113. Now I will talk about the importance of nutritional advice for diabetic patient. So why nutritional advice is important for diabetic patient? First, patient can maintain stable blood glucose level by eating a well-balanced diet suited to their needs. Patient can achieve and keep a healthy weight. Patient can reduce their risk of cardiovascular problems. Patient can have consistent energy levels to avoid sudden changes in blood sugar. Patient promote a balanced diet, meeting their needs and preference while ensuring vital nutrients. And lastly, nutritional advice consider the particular characteristic of each diabetic patient. That's all from me. Next slide will be presented by my colleague. Thank you.
Hello everyone, my name is Zefanya, Rindy, Nathalie, Pranoto with the last digits of student number 166, and I will explain about the threats of going to vacation for diabetes patient. So going on vacation can be exciting and enjoyable. However, individuals with diabetes must be aware of some potential threats. The first one is change in meal routine. Traveling often involves changes in meal times and the types of food available. This can pose a threat to people with diabetes who need to maintain a consistent eating routine and make healthy food choices. The second one is limited access to medical supplies. When traveling, access to diabetes medicines and supplies may be limited or unpredictable, especially when traveling to remote or unfamiliar locations. And the third one is time zone change. Traveling across time zones can disrupt sleep patterns and affect insulin doses and meal times. The next one is illness. The consequences of illness for people with diabetes can be more severe due to the disruption in blood glucose control. And the last one is climate. Hot and cold climate can affect blood glucose levels and increase the risk of hypoglycemia or hyperglycemia. Maybe that's all from me. The next slide will be presented by my friend. Thank you.
Hello, my name is Fauzan Mikajavani with the three last digit of my student number is 131. My name is Fauzan Mikajavani with the three last digit of my student number is 131. So the nutritional advice for patient with diabetes, there are many readily available evidence-based dietary recommendations that differ slightly between type 1 and type 2 diabetes. The major goal for people with type 1 diabetes is to keep blood glucose level as close as to the non-diabetic range as feasible while avoiding the hypoglycemia. The number of 90% of type 2 diabetes patients who are overweight or obese receive weight loss as their main suggestion.
Okay, hello everyone. My name is Putu Diva Prilana Artha with three last digit NIM numbers 238. So I'll continue the presentation about the risk factors of non-adherence to the nutritional advice. Okay, talking about the factors of non-adherence for the nutritional advice. So the present study identified several significant risk factors for low diet adherence, including the first one, dissatisfaction with the doctor-patient relationship. The second one, lack of disease knowledge, and then diabetes duration, and then illiteracy, and then traveling, and then the patient's own misconceptions of the disease.
Hello, my name is Carla with the last three digits of my student number is 081, and I will explain about threat towards non-adherence of nutritional advice. Threat towards non-adherence of nutritional advice can lead to hypoglycemia or hyperglycemia, weight gain, unstable blood glucose level, and poor diabetes control. That's all for me. Thank you.
Allow me to introduce myself. My name is Carla Manullang with my last three digits are 146, and now I am going to give summary and recommendations for our student group presentation. So, diabetes mellitus occurs when insulin production in the pancreas is insufficient or when insulin cannot be used effectively by the body. According to American Diabetes Association, diabetes was divided into four big groups, such as type 1 diabetes, type 2 diabetes, gestational diabetes mellitus, and specific types of diabetes due to other causes. Nutrition therapy or proper food management is one of the four pillars of diabetes management. Nutritional advice are the guidance and recommendations provided by professionals to improve dietary habits and overall well-being. Going on vacation can be exciting and enjoyable. However, individuals with diabetes must be aware of potential threats such as climate change in meal routine, limited access to medical supplies, time zone change, illness, and climate. The major goal for people with type 1 diabetes is to keep blood glucose levels as close to the non-diabetic range as visible while avoiding hypoglycemia, while main suggestions for people with type 2 diabetes are taking weight loss to treat overweight or obese. Significant risk factors for low diet adherence, including dissatisfaction with the doctor-patient relationship, lack of disease knowledge, diabetes duration, illiteracy, receiving treatment from government hospitals, traveling, and patients' own misconceptions of the disease. Vacations often present challenges for individuals with diabetes as they disrupt established routines and expose individuals to unfamiliar food environments that can lead to non-adherence to nutritional advice. Next, the recommendations are planning ahead and patient adherence is essential to traveling with diabetes. It is important to have a comprehensive medical exam before travel to make sure the diabetes is under control. Patients also need to increase knowledge about diabetes, how to use medical devices and procedures to treat diabetes, and the situations and conditions of tourist destinations such as type of food, weather, routine activities there. That's all from our presentation. Thank you all for your attention.